Hello, welcome. I'm Dr. Danielle Hadi De Silva. If you've attended one of these Better Health Thursdays in the past, you have seen my face and heard some of what I've had to say about different topics. Today, I'm going to be presenting on beating the blues. And I'm happy to be here again with you all to discuss this very important topic. The truth is, feeling blue is something people say that may or may not adequately describe how they are truly feeling. This idea of feeling blue may be a way of minimizing or masking a deeper sadness that a person might be feeling. What they might actually be experiencing is depression. So you will hear me throughout my presentation today using the word depression as well as the term the blues. My hope is that through this presentation, each of you will walk away with a deeper understanding of what is depression, how to cope with it, both personally and if someone you care about is experiencing depressive symptoms. So happy to be here. I am a teacher. I teach graduate studies with Purdue University Global. And I usually start off my class with quotes or comics. My students find it interesting and thought-provoking. So I thought I would do the same today. Here's a quote by theologian and civil rights activist Howard Thurman. He said, "Don't ask yourself what the world needs. Ask yourself what makes you come alive, and then go do that. Because what the world needs are people who have come alive." You will notice that the word depression is not even mentioned in this quote. It's all about figuring out what might help someone to feel more engaged, to be an active agent of change in their lives so that they can go on to find not only what makes them happy, but what can help them cope with life most effectively, which for me is what beating the blues is all about. When people hear the word depression or the blues, various ideas come to mind. Some people think of depression as a character flaw and believe erroneously that something is inherently wrong with them or with the person suffering from the blues or with depressive symptoms. Or they might think the person suffering from depression is crazy. I hear that word a lot in my practice. Maybe that they're unable to cope with life. Conversely, you might hear someone say they are feeling blue and think it's just a fleeting feeling, something easily overcome, when in fact, that label may not adequately address or describe the depth of what they might really be feeling. This misunderstanding about depression is reflected in the many myths that exist about it. Myths like people who have lots of money and or lots of friends do not get depressed, or the belief that religious people do not or should not get depressed because of their strong faith in God, thinking that maybe that makes them immune to those kinds of feelings. That you're feeling depressed because you have done something wrong. And a lot of people feel ashamed that they have emotional problems and think that they should be able to cope with depressed feelings on their own because they're grown or well-educated or successful professionals. There are also myths about how depression affects the young, that teenagers and children do not get depressed or do not feel blue. Some people think that no one can help them and that they need to keep their depressed thoughts and feelings to themselves. Depression is not a sign of weakness, and it is more than just feeling down or blue. Depression is more common than you think. So for anyone suffering from symptoms of depression, please know that you are not alone. In September 2021, the World Health Organization reported some important statistics on depression. Globally, it is estimated that 3.8% of the population of the world is affected by depression. Approximately 280 million people in the world have depression. According to the WHO, 5% of adults suffer from depression, and that more specifically, depression occurs at a rate of 5.7% among adults older than 60 years. More women are affected by depression than men. And at its worst, depression can lead to suicide. Over 700,000 people die due to suicide every year. Most alarmingly is that suicide is the fourth leading cause of death in 15 to 29-year-olds. This last statistic alone is cause for grave concern because it demonstrates that some of the myths about depression and suicide do not hold water. And more importantly, that we need to be aware of how depression can and does affect the younger generation. Within the medical and clinical communities, our understanding of depression has certainly evolved over time as our knowledge base has increased, thanks to the vast amount of studies that have been conducted in this area. The most prevalent understanding of depression, or the blues, is that it is considered a serious medical condition that can affect your mood, your body, and your thoughts. There are many causes of depressive symptoms. Biological changes, for example, in the neurotransmitters of your brain or due to hormonal imbalances. Depression can also be caused by serious physical or medical problems. Or it might be familial, meaning that there is a family history of depression. One's coping capabilities might also affect whether life events could lead to depression. Here are just a few of the major situations or life events that could potentially lead to depressive symptoms. A relationship ending, death of a loved one, divorce or separation, personal illness, the development of a physical disability, being bullied or harassed, experiencing an assault, academic difficulty, unemployment, financial difficulties, low self-esteem, being lonely, unrealistic standards, and unwarranted self-criticism. Truthfully, any situation that is perceived by someone to be out of their control, that they might be incapable of coping with, could result in feelings of depression. In many cases, it is not just one of these situations that leads to the onset of depression, but multiple causes that come together or build upon each other. The interaction of several of these situations at the same time could result in a downward spiral and deep depression. People talk about depression on a continuum. Some people call it having the blues, hence the title of this presentation. Using the term the blues might indicate milder symptoms. Others describe what they are feeling as depression, which might indicate a greater intensity of symptoms. Some people use the word sad to describe what they are feeling and have no explanation for why they might be feeling that way. We do know, based on copious amounts of research that has been done on this disease, that there does exist a continuum of depression, that there are mild, moderate, and severe symptoms which lead to a diagnosis of mild, moderate, or severe depression. In the same way that different situational factors might trigger different people, depression does not look the same for everyone. I want to share a couple stories with you so that you can see how depression might manifest for some people. This is Janet's story. I noticed that when the morning came, I just did not want to get out of bed. I just wanted to hide under the covers and avoid everyone and everything. I was also losing weight and just didn't feel like eating. I was so tired, but yet I couldn't fall asleep at night. Nothing felt right. Nothing felt enjoyable anymore. I didn't want to go to work and missed more than a few days. It just felt so impossible, like nothing was going to change or get better. Now here's Sergio's story, which paints a slightly different picture of what depression might look like. Sergio shared that, sure, it started off as me feeling kind of sad for no reason, but then it turned to anger. And I started having fights with my family and friends. I felt so bad about myself, like I wasn't good enough. It got so bad that at times I thought I just want to go to sleep and never wake up. As you can see, there are some similarities between what Janet and Sergio experienced. They both felt sadness, at least initially, though Janet's story reflects the more traditional or expected symptoms of depression. But with Sergio, he also had feelings of worthlessness. In addition, he felt anger and had conflict with his loved ones. Some might look at him and think, well, that isn't depression at all. He's maybe having some kind of anger management problem. But the truth is that all of the symptoms presented by both of these individuals are part of the gamut of depressive symptoms. But which case would be considered more severe? How would you know whether you're trying to beat the blues or if what you're experiencing might be severe depression? Let's look a bit more closely at what are some of the general symptoms of depression. Here's a checklist that represents the most common signs and symptoms of depression. I am really sad most of the time. I don't enjoy doing things I've always enjoyed doing. I don't sleep well at night and I'm very restless. I'm always tired and find it hard to get out of bed. I feel like eating all the time. I have lots of aches and pains that don't seem to go away. I have little to no sexual energy. I find it hard to focus and I'm very forgetful. I am mad at everybody and everything. I feel upset and fearful, but can't figure out why. I don't feel like talking to people. I feel like there isn't much point to living. Nothing good is going to happen to me. I don't like myself very much and feel bad about myself most of the time. I think about death a lot. I even think about how I might hurt myself. I would say the specific items and the number of symptoms checked off on this list would determine where on the continuum someone falls in terms of whether they are mildly, moderately, or severely depressed. If someone identifies with several of the items on this checklist, then this is someone who might be severely depressed, particularly if someone is thinking about hurting themselves or having thoughts about death. This is someone who should seek professional help from a doctor or a counselor, as it is more unlikely that they are suffering with severe depression and should take immediate action to address their symptoms. So, what are some of the other key indicators that might help you determine if and when you need to seek professional help for something like this? I would say the most important thing is to pay attention to whether symptoms are getting worse and not better or less severe. Another important thing to pay attention to is whether you're experiencing feelings of hopelessness, meaning you think your situation or life just can't or will never get better. Ask yourself if you've lost interest in things you used to previously enjoy. For example, you used to enjoy going to church or liming with friends, but now you just want to stay home, avoid people, and self-isolate. Notice if what you're feeling starts impacting the different facets of your life and functioning, meaning you can't get out of bed in the morning, you start missing work, you're losing weight rapidly, maybe suffering from constant physical symptoms like headaches or stomach problems. And most especially if you're experiencing suicidal thinking, if you're having thoughts of hurting yourself, or find yourself wishing that your life would just somehow come to an end, then you need to immediately seek help at the closest hospital or by calling your doctor. Regardless of where on the continuum you fall, it is important to deal with what you are feeling. However, despite how bad some people might be feeling, there might still be resistance to seeking help for depression. People try to minimize what they're feeling. They want to think that what they are experiencing is something that will just go away. They tell themselves they don't have time to stop to figure it out. They may think that what they're feeling is something made up or in their heads. Another big reason people might not seek help is because they worry about what other people might think of them. They worry that if they seek help, people will think less of them or see them as weak or crazy. There is still such a negative stigma associated with seeking help and mental health services that people are scared to get whatever help they need. Despite these fears and concerns, though, it is really important for people to get the necessary help to deal with what they are feeling. Because the reality is, depression can get worse. It could lead to a downward spiral, create other health issues like ulcers or muscle pain. It could lead to alcohol or substance abuse, cause increased anxiety, cause disruptions in your home life, and maybe even be so debilitating that the person experiencing depressive symptoms is unable to reach out for help when they most need it. For example, if they become suicidal. If depressive symptoms are more on the mild to moderate side, if you would describe what you're feeling as feeling blue, there are some things a person can do on their own to cope. Try to manage stress by practicing relaxation techniques or mindfulness. Avoid being alone for long periods. Have a regular bedtime, eat a healthy diet, get moderate daily exercise, engage in spiritual practice, avoid taking on new or difficult tasks at work or at home, record and report all medication side effects, keep scheduled appointments, especially with your doctors, practice gratitude, take up a hobby, volunteer if possible. I'm going to cover a couple of these more in depth so that it becomes a bit clearer why they might be helpful to and for beating the blues. Let's start with volunteering. Why does or can volunteering help with regards to depression? Volunteering has been called a natural antidote to stress. Helping others has shown to successfully boost spirits and promote well-being. Helping in your community can help you battle despair, provides a sense of purpose and hope, and connects you with others, and helps to create a more active and positive lifestyle. Sleep disruption is one of the most common and troubling symptoms of depression, be it mild or on the more severe side. Not only is sleep trouble a common symptom of depression, but it is one which can have detrimental consequences for the mind and body. When I used to work at university counseling centers, I can't tell you the number of students who experienced severe disruptions in their functioning due to lack of sleep because they were trying to pull all-nighters for days at a time while they studied for exams or tried to get projects done. People with depression can experience trouble falling asleep and trouble staying asleep, meaning they wake up multiple times throughout the night. As a result, people feel fatigued and experience a lack of energy throughout the day. The good news is that these types of sleep problems respond well to treatment for depression, be that medication or therapy, and we'll talk about that in a minute. In the meantime, developing a sleep routine could help the body and mind to prepare for sleep. A sleep routine involves having a regular bedtime, going to sleep and waking up at a set time every night, even on weekends. The exact hour doesn't matter once you stick to it. A bedtime ritual also helps. This could be having a warm cup of tea or a bit of milk before you go to bed, maybe lotioning up your hands right before you go to sleep. You could also do a brain dump, which I know sounds like a strange thing to do, but by writing in a journal or notebook about the things you are worrying over, or even better, that you are grateful for, can help you refocus and release negative thinking. I do this almost every night. A sleep ritual like this is anything that you do right before bed that again signals to your body and mind that it is time to rest. One very important thing I want to mention here too is that it is recommended that you reserve the bed for only sleeping. It's not a good idea to read or watch TV or use your electronic devices while you're in bed. When the body hits the bed, it needs to receive the signal that it is time to sleep, to rest, to wind down, and recuperate from the day. Getting better sleep can help you feel good both physically and emotionally, and will allow your mind to function better, thereby helping you to cope better with the blues and/or more severe depressive symptoms. We have heard time and time again how important exercise is, not just for our physical health, but it can also aid in improving emotional well-being. There are numerous reports that demonstrate how routine exercise can improve mood. When I talk about exercise, I'm not necessarily endorsing going to the gym or some kind of exercise class, because I know that for people suffering from depression or any kind of the blues, this kind of outing or activity can be daunting. I want to recommend here mindful walking as an option. And if you've attended my sessions in the past, you've heard me talk about this before. Mindful walking or walking meditation is the intentional act of walking. This does not mean walking and looking down at your feet as you walk, but bringing awareness to the experience of walking. It involves focusing on the sensations in your feet or legs, or even feeling your whole body moving. Being aware of your breathing and paying attention to the sights and sounds around you. So next time you set out for a walk, do so with intention. Put your phone away. Don't even plan to listen to music or talk on the phone. Start by setting a specific period of time for your walk, maybe 10 minutes. And as you begin, walk at a natural pace. You can count your steps if it feels more comfortable, and just pay attention to the movement of your body. Then you're going to expand your attention to all the sounds, smells, and sights that are around you. Not all at once, but focus on one after the other in sequence. Sounds, smells, and then sights. Then if you can, expand that awareness even more fully as you take in everything around you, God's beauty, God's majesty. Walking meditation can anchor your mind to the present moment. So you're not up in your head thinking about how badly you feel, about how awful your life is, about all the what ifs or maybes that you have spiraling up there. Since we're on the topic of mindfulness, mindfulness can be used as a stress management technique, which is important because stress can play a major role in depression. There is undoubtedly a lot going on in our world today that could cause us to feel stress. There's COVID, there's illness, financial hardships, our new normal, needed adjustments all around, a whole slew of stuff. The worry and anxiety that accompany difficult life situations can increase the risk of feeling blue and developing depression. Considering stress management techniques and utilizing these allows us to engage in more constructive ways of responding to situations, which means there is less likelihood of them leading to depressive symptoms. So, coming back to mindfulness as a stress management strategy, let me start by explaining what mindfulness is. According to its creator, John Kabat-Zinn, it is the awareness that emerges through paying attention in a particular way on purpose in the present moment and experiencing non-judgmentally the unfolding of moment-to-moment life. It speaks to the tendency we have as human beings to constantly be in our own heads, mulling things about, playing things over and over, rather than being fully present in the moment, especially in the hard and stressful, depressing, blue, sad moments. Mindfulness is the intentional choice to become aware of whatever moment you are in, to simply be an observer, to be open to whatever is happening, whatever you're feeling, without adding anything extra like an opinion about things maybe or should be or could be. How is all this related to depression? Well, how much we think and how much we think about a particular situation, about our capacity to cope with that situation or what we are feeling, is directly related to the experience of depressive symptoms. But if instead you are focused on the here and now, non-judgmentally, observing your feelings and just letting them float on by, those stressful situations and feelings could impact you less. Relaxation techniques such as deep breathing is another great stress management strategy. Breathing is the simple and easiest stress management technique you can implement. It is something you can do anywhere, anytime, and no one has to know you're even doing it. Deep breathing oxygenates your body fully so that you and your body can function optimally. Also, when you're actively breathing, you can't also be thinking about negative thoughts, negative feelings, both of which are part of depression. All you can do is think about breathing. I want to teach you a quick breathing technique now. I feel like it's important to always give people something that they can walk away with and use and practice. And as I said, this quick and easy breathing technique is something that you can do anytime, anywhere. So it starts like this. You can do it with your eyes open. You can do it with your eyes closed. And you take a deep breath in through your nose while silently counting in your mind to 6. You hold that breath for a count of 6. And then you slowly release that breath through your mouth for a count of 6. I will tell you that for some people, taking that deep breath in and trying to count for 6 and hold for 6 and release for 6 is hard at first. You may have to start with a count of 4. You work at your pace and with whatever number or count is comfortable for you. I've worked my way up to a count of 8, but for some people, 4 or 6 is most comfortable. So you do that and you practice it and you see how you feel. Also, I want to delve a little more deeply into another useful stress management technique, which is practicing gratitude. Establishing a gratitude practice is another excellent way to not only cope with stressful situations, but also shifting the negative thinking that contributes to depression. Practicing gratitude on a moment-to-moment basis is an excellent way of grounding yourself in the present, which is incidentally also a useful aspect of mindfulness practice. So it's win-win. If you're constantly aware of the moments throughout your day that you are grateful for, then you will be truly grounded in the here and now and can not only experience a sense of appreciation, but also avoid overthinking, and negative thoughts. It may be helpful to tangibly see what you have in your life to be grateful for. So it might be helpful to grab a notebook or journal and jot it down at the end of each day, all the things big and small that you're grateful for. Two other things that I wanted to mention quickly are engaging in spiritual practice, like going to church or mosque or temple, and avoiding taking on new or difficult tasks. Depending on your life circumstances, this might be a tough one, but I would highly recommend that you keep to a set routine and take on only what feels manageable while you're dealing with your sadness or your depression. Depression is an illness that can cause a tremendous sense of loneliness and isolation. Because of how depression affects us, leaving us feeling tired and hopeless, lacking enjoyment in life, many depressed people withdraw from everyday life and stay away from loved ones, stop doing the things that they previously enjoyed doing. They disengage because they think it will be easier than facing life and people. But the reality is, when depressed people isolate, they can become even more depressed. So the less you do, the more depressed you feel. And the more depressed you feel, the less you do. It's that downward spiral that I mentioned before. Research has shown that for people experiencing mild to moderate depression, becoming more socially active can actually help in the recovery process. I'm not talking here about doing any kind of strenuous social activity, any hardcore liming, but more so simple things that don't require much energy, like maybe going to a movie, meeting someone for coffee, going for a walk together, maybe a bit of mindful walking. Remaining in contact with one's social support system is especially important for those individuals suffering with severe depression who are also experiencing thoughts of suicide. For these individuals in particular, being alone could be dangerous. And in fact, the risk of suicide is much higher for those who live alone and have no social support. I want to say emphatically here that anyone experiencing suicidal thoughts at this time needs immediate medical help and should contact their doctor or go to the nearest hospital. Let's talk now about getting professional help for dealing with depression. Step one is to identify what you're feeling or experiencing and accept that depression is a real illness. What I've covered so far hopefully has helped you develop a greater understanding of what depression is and what it looks like, so you know what to look for. Step two is to make an appointment to go see your doctor. This could be your general practitioner or a psychiatrist or a counselor if you're able to see one. Step three is that you need to be honest with your healthcare provider about what you're feeling and experiencing. It does not help you to get all the way to the doctor only to play down your symptoms or leave out important information about what you're feeling. Step four, and this can be the hardest part for some people, is to follow treatment recommendations. Let's talk about what doctor recommended treatment for depression might look like so that you have a better idea of what to expect. Your doctor might prescribe medicine for you to take. Some people are very resistant to taking medicines that are used to treat depression. I always explain to my clients that taking medicine to treat depression is like taking medicine to treat high blood pressure or diabetes. Remember that depression is a medical issue. You wouldn't resist getting cursed when you've broken your arm or leg, so don't resist medicine to treat your very real medical problem. I want to also mention here that some medicines take a few weeks to work. You're not going to feel better right away. It's important that you stay in touch with your doctor about how you're feeling. If after a few weeks, though, you haven't experienced any change, you're not feeling any better, then a change in medication might be needed. Then there's talk therapy, which involves talking to a psychologist, a social worker, or counselor. This talk therapy is an important part of the process because through this experience, you will learn how to cope with your feelings and how to change your thinking. Your therapist might give you homework to complete or handouts to read. This is a way of continuing the therapy work outside of session, because if you think about it, you are only in therapy for maybe 1 hour a week, possibly every other week, maybe even once a month. So doing your own work in between sessions could speed up the healing process. Lastly, in some cases, a therapist might deem that a group therapy option might be an available and useful addition to treatment. This is an opportunity to talk with others who might be experiencing similar symptoms, to share one story, to learn from others. The research shows that group therapy can be an excellent adjunct to individual therapy, so stay open to that as an option. I want to speak just briefly here about the role of negative thinking. And I mention it here because many counseling professionals will introduce this as part of their treatment approach to treating depression. Thoughts cause feelings. You may have heard this statement before. So if you, for example, think that everything in your life is awful or that your life can never get better, you are feeding that feedback loop, which leads to you feeling more depressed. But if you change that thought, you change the feeling. So for example, if you tell yourself, things will get better, there are things that I can do to help myself get out of this awful feeling, then you are taking active steps to feel better through that active and intentional change in your thinking. This kind of thought restructuring, or cognitive restructuring, as it is called, is part of cognitive behavioral therapy, which has been empirically proven to treat depression and alleviate depressive symptoms. So you might want to seek out a counseling professional who does cognitive behavioral therapy, or CBT, or who uses it as a treatment approach. In terms of finding clinical help for dealing with depression, these are two of the best local resources I can recommend. One is the Trinidad and Tobago Association of Psychologists, and the other is the mental health unit, which is available through the Ministry of Health. I've included the websites here and encourage you to write it down if you feel like you need to seek help, because you can find resources for people who are practicing or providing services in different parts of the country at these two websites. I know that some people, one second here, resist seeking help because they think they just don't have time to deal with their depression. They're busy working, trying to manage life the best they can. The reality is that many of us spend more time at our place of employment than anywhere else in our lives. If you're depressed, your ability to work and the way you feel about your job might be affected too. Your job performance is probably being impacted. You might be calling in sick or arriving late, maybe missing deadlines. People at work might be noticing a change in you, your demeanor, your level of engagement, and your interest in what you are doing. You may be worried that taking time off to seek help might affect your job security. And that's a fair concern. But the truth is, if you don't get help, your job might be at risk because of how your depression might be affecting you and it. Talk with your supervisor or boss and maybe frame it as wanting to work on some personal issues so that you can be more effective at work. Check to see if your insurance offers any coverage for mental health treatment. And if you have to take time off, or even if you seek treatment while still working, when you start to notice that you are transitioning back to a regular work life, that things seem to be going better at work, that you are performing better at work, it can actually be a very positive sign that one has begun to go on and live. Many of us are in relationships too. If your partner is depressed, it would benefit you to become as informed as possible about depression so that you can understand the illness better. Specifically, be able to recognize the symptoms, which were covered in that checklist that I presented earlier. Encourage your depressed loved one to seek help and provide help to facilitate the process. Be forgiving. Remember that depression can cause changes not only in mood, but also behavior. So try not to take it personally when they yell or express anger or don't want to spend time with you. And focus instead on attributing the behavior to the disease and not the person. Encourage your loved one to see friends and to engage in normal activities they usually enjoy. Make sure you notice and praise any significant improvement or positive changes, because this validates all the hard work your loved one is putting into their recovery process. Practice your own self-care. Be sure to eat right and get good sleep. Take time for yourself and pay attention to your own mood and behavior, because depression can cause pain for caregivers and for loved ones as well. I want to say emphatically here, though, that you are not responsible for fixing your loved one's problems, or mood. Your job is not to give advice or to take charge of their situation. What you can do is listen, support, be comforting, and direct them to services if possible. So be supportive. Don't try to minimize their feelings or pain. Show that you care by listening without judgment, by nurturing. Be honest. Let your loved one know you're concerned. If you're frightened by something they have said or done, tell them so. Don't fake cheerfulness. Help them to locate help or services. Research doctors for them, get them contact information for counseling professionals. Maybe offer to transport them if needed, or to sit with them while they're waiting to see the professional. Sometimes the fear of the unknown can be scary too, and having company is all the support they need to follow through on seeking treatment. Back off if you need to. There's a reason we need to seek professional help in these situations. We can be so personally and deeply impacted by the feelings and moods of our loved ones that we can lose our cool when talking to them or get so upset that we can't even communicate effectively. So if you feel yourself feeling frustrated or lashing out, take a step away. On that note, I want to say that depression is treatable. You can go on to live a happier and healthier life. You can beat the blues through the utilization of any of the things that I've mentioned here today. You just have to be willing and able, as Mr. Thurman said at the beginning in that quote, to ask yourself what makes you come alive and then go do that. I want to thank you for your time today. And if you have any questions, I would be happy to answer them now.